Good afternoon, everybody. We're just going to give it a few moments. Sorry for starting 5 minutes late. We just had some technical issues. We're just going to allow everybody to enter the lobby. Thank you very much for your patience. Okay, I think I'm going to start now. I see they're still coming in. Yes. Good afternoon. My name is Cecilia van der Zijde, and I'm part of the Tempo Wellness team. I wish to welcome everybody. Thank you very much for your time this afternoon to listen to our Tempo talk. And our topic today is eye care awareness. Our speaker for this talk today is Maryke de Jager. She is a registered optometrist, and she has a passion for the optometry industry and strives to make a difference in each and every patient's lives by giving vision and lives hers. She's a proud co-owner of Maryke de Jager Optometrist, which was established in 2020. She specializes in contact lens fittings, including hard and scleral contact lenses. Her education was at the Kroonstad High School, and she matriculated in 2009. And I'm very happy to welcome you, Maryke. Thank you very much for your time as well, and we're looking forward to listen to you today. And yes, so the floor is yours.
Thank you so much, Cecilia, and good afternoon, ladies and gentlemen. Apologies from my side also for the technical problems. After all, I am in Bethlehem, so this is the countryside of the world, and if anything in Bethlehem works when it comes to the network and Wi-Fi and all of those things, electricity, then we are delighted and happy. But I am very excited. Thank you so much, Cecilia, for the introduction, and well done on your pronunciation of the contact lenses. Still to this day, not even my husband can say scleral contact lenses properly. So I'm very impressed about the fact that you could pronounce that correctly. So I'm very excited to be with all of you this afternoon. I'm envisioning the fact that you are all in my living area today at home, and we are just going to have a nice casual chat and visit about the importance of eye care. And the timing is perfect because we are celebrating Eye Care Awareness Month. I will get to that a little bit later. Cecilia, just to ask you, am I in a control of the slides? Can I go back
you
to?
can, I don't think so, because I'm sharing the screen. You can just go with your cursor to the left-hand side and see if you see any arrows. If you don't, I see my arrows, then it means I'm the only one in charge. In charge.
So you are in charge indeed. Good.
Okay,
Cecilia,
please.
you can skip to the next one. Thank you.
Can I just also add, which I forgot to say from the start, is we will give some 15 minutes or so for some questions afterwards, so that we don't interrupt Maryke while she's doing a presentation. Thank you. I'm going to the next slide.
Thanks, Cecilia. Good. So this is a very powerful saying to me. It's unbelievable how powerful you can be when you have clear vision. And I do think we need to stand still with this quote for a minute, because we don't really realize the power that we have in our eyes. So I'm delighted to stand before you today to shed light on the crucial topic of eye care awareness. After all, our eyes are the windows to the world, allowing us to experience the beauty that surrounds us. But we often take our vision for granted, neglecting the essential care it requires. So today we will explore the significance of maintaining healthy vision, common eye problems, preventative measures, and the benefits of regular eye checkups. That is something that I regard very important. So let's dive in and discover the secrets to optimal health. You can go to the next one, Cecilia. Good. So what we are going to talk about today is the fact that prevention is better than cure, how to invest in simple steps on how to maintain good eye health, common eye problems, the benefits of regular checkups, and then Eye Care Awareness Month, which will be from the 24th of September to 18 October. Good, next one. Okay, this is just a little bit of the introduction Cecilia already did. What I didn't tell you in my bio, it is in my bio, but I do have experience in the contact lens representative field. I was a contact lens rep for the company called Cooper Vision for a few months, and it really helped me with experiencing the field in a different way. And it grew my love for the contact lens field tremendously. I'm very excited to talk to you about contact lenses later. And then I'm a mom of 3. Sorry, Cecilia, you're... I'll just say that I'm a mommy of 3 and a mommy to be of the latest addition to the De Jager family, so happily pregnant. And then again, my motto in practice: by giving vision, I live mine. This was actually something I dreamt when I was still at school. So I'm privileged to say that I had my dreams fulfilled after school when I had this dream and studied optometry. Good, we can go to the next one. So I often encounter people next to the sport field, in church, even in Checkers, telling me, I need to get to you. I need to come for an eye test. I've never been for one. Then I'm thinking, you are 52, 46. You are you've had a few years in life and you never had your eyes tested before. And I do think a very relevant question when it comes to those people doubting whether they need to come or not is what and how I see normal. Is what my eyes see normal? Should I see the way I am seeing at the moment? And it's a very relevant question. If you look at the next slide, our eyes are the windows to the world. Now, we use our eyes. This is actually a fact. One uses his or her eyes for more than a third of their lifetime to perform and complete daily tasks. Now, let's just stand still at that fact for a minute. Think about how hard your eyes work, even from the day that you were born. Now, I've got young children. My youngest is 20 months old, and I'm amazed by the fact that I can experience on a daily basis how her eyes are developing, the things that she's able to see at the moment, the things she was able to see from a young age, from a few months, even from a few weeks old. And our eyes continue to develop. We believe that up until the age of 8, there's a lot of development happening. So more than a third. I mean, if you take your lifetime span and you take a third of that, that's quite a lot. So your eyes do work hard, and that's why it's so important to look after them. So our eyes enable us to connect with others. That's why we have this picture of the hands connecting. They enable us to navigate our environment and enjoy various activities. Now, imagine not being able to see this beautiful scene of nature. I can't even imagine. So fostering healthy vision ensures a higher quality of life for individuals of all ages. Whether you're a student, an employee, or a retiree, maintaining good eyesight is paramount for success, productivity, and even overall well-being. I do see that often, patients coming to visit me sitting in my examination chair, not really enabling me to determine what their personality type is, because they're very shy, very reserved, they don't say much. And when I test their eyes and I realize that they can't really see properly, I do understand the way they are, because I do think your self-esteem takes a bit of a dive if you can't see properly. For example, yesterday I had a guy, he's 32 years old. He thinks the way he sees is normal, right? He's a Comrades runner. This year he did the Comrades sub 6 hours. I mean, how amazing is that? He's got a lot of goals ahead of him in terms of running. When I checked his vision for both eyes, he had 6% unaided vision. He sees 6% of the potential 100%. So I thought to myself, how did you get here? But regardless of that, I did an eye examination and I saw that he had cataracts. We will talk about that later. So I'm trying to get him into the governmental system to get his cataracts removed, and obviously to give him better vision, because there I know your self-esteem will lift up, and you will be a much different person than the one that came to see me initially. And I do see that a lot. That's a very rewarding part of my work. Although I don't work a day in my life, I love my job. It's for people to give them something to make their vision better, and then I know that they will be a different person. Cecilia, thank you. We can go to the next one. So maintaining good eyesight is crucial for success, productivity, overall well-being, that I already said. Common eye problems. Let's have a look at that. Good. Next one, Cecilia. Thank you. So you are head girl for this afternoon. Good. So we have two divisions here. I divided the common eye problems into two divisions. So first of all, let's talk about refractive errors. Refractive errors can be corrected by glasses and or contact lenses. Now, that is for the most part of my daily practice living. We prescribe or dispense glasses and or contact lenses. The most common refractive errors is myopia. That's a fancy word for nearsightedness, which means that you cannot see clearly at a distance, or you cannot see far. Then the next one is hyperopia. This is farsightedness, so which means one cannot see clearly at near. Then you get something called astigmatism. Now that's also a word that's pronounced wrongly quite often. It's a tongue twister. Now, astigmatism means, in layman's terms, that your eyeball is not shaped like a netball or like a soccer ball. It's more shaped like an egg. Now, a lot of optometrists will refer to astigmatism as your eye being shaped like a rugby ball. To me, I'm a very visually driven person. I don't think that one would like to know that your eyeball looks like a rugby ball, because where's the cone pointing to? I refer to it it's shaped like an egg. So you've got a flat, elongated plane, and then a shorter, steeper plane, if I can call it like that. I will show you an example now. So myopia can be combined with astigmatism, as well as hyperopia can be combined with astigmatism. In other words, you can have hyperopic astigmatism or myopic astigmatism. So those three can go together. And then the fourth one is presbyopia. Now, all those 40 pluses, if you can go back to your reference network, when you are sitting in a restaurant with friends, what do you take out of your handbags first when looking at a menu? Reading glasses, right? You are all nodding at the screen at the moment, all of those who are age about 40. So it's not set in stone that it happens at age of 40. Doesn't mean yesterday I was 39, this morning I'm turning 40 and all of a sudden I cannot see near. It's just the age-related loss of the ability to focus on nearby objects. Therefore, you would need a pair of reading glasses. Now, some people are lucky to experience this only later in their 40s. My husband was unlucky to experience it at the age of 38 already. But in Afrikaans, we talk about the long arm syndrome, the long arm syndrome. So at the end of the day, you would need a selfie stick to put your cell phone on the selfie stick to take your cell phone further to see clearer, just on the lighter side of things. Thank you, Cecilia. Next slide. Good. So this is an example of what a person will see with astigmatism, with an eye that's not shaped roundly. You will see that round objects will appear more oval, straight lines won't appear as straight as they should. And you will see a lot of glare, a lot of streaks inside a round light. Glare is basically the best description. So on the left-hand side, the person has got astigmatism. On the right-hand side, that's more towards the normal side. Good. If we look at the next slide, I'm going to talk about the pathology side of what we see quite often in practice. Now, depending on the area where you practice, obviously in Bethlehem, as I always make a joke about it, that we are in the countryside of the world. In Bethlehem, we do encounter a lot of a lot of pathology cases because we're not in a big city where we have a lot of numbers. People come and see you if they don't see well, and then you must determine the reason, and often it is a pathology reason. Now, cataracts are very common. You do get that more often in the in the higher age group. Let's say it depends. Like I said, this patient of mine yesterday was 32 and he had cataracts in both eyes. That's an exception. I also do have another friend, she's 27, and she got a cataract in one eye due to preeclampsia that she had when she was pregnant. So her blood pressure had a spike, and she's got a traumatic cataract in one eye. So first of all, what is a cataract? It's clouding of the lens inside the eye. Now, before we go on to the next slide, where I will explain the anatomy of the eye, if you think about a window, when you look through a window, you would want that window to be clean, right? For you to be able to see what's beyond the window and for you to see it clearly. Now, a cataract makes your window of your eye very cloudy. You will see it clearly in patients with mature cataracts, but sometimes you really do need to go look for it with specialized equipment. As I said, it's more prevalent in your higher age groups. I would say 60 and above, definitely 80 and above, you need to check for it, because then you can expect it to be more prevalent. Right, glaucoma, something that is like, it's a very sly condition. It's not too obvious. You also have to go look for it, but it's optic nerve damage caused by high intraocular pressure. Now, intraocular means inside the eye, and we all know what pressure is. So the eyeball's got pressure on the inside. The next one is age-related macular degeneration. Very sad story if it happens to one of our patients, because you do need to explain that with a lot of care, but also set your patients' expectations to be correct for the future, because AMD is not something that can be treated easily. It cannot be reversed. It can only be slowed down. So it's a vision loss in the central part of your visual field. So basically, when you look straight ahead, you will have these blank or black spots in the center of your visual field. Then you get diabetic retinopathy. It's damage to the blood vessels inside the eye due to diabetes. And then the next one is hypertensive retinopathy, which is damage to the retina and blood circulation due to high blood pressure. We do see that often in the Free State, with the farmers having high stress levels and high blood pressure not being controlled, or them not going to the general practitioners too often. Thank you, Cecilia. We can have a look at the anatomy of the eye next. So this is basically, if I can explain the left side of the screen, the eye anatomy. So we all know that the color part of the eye is called the iris. The black dot inside the iris is called the pupil, and then the white part is called the sclera. Now remember that for when we later talk about the scleral contact lenses. Now let's have a side view of the eye. On top and at the bottom and to the sides, we do have the eye muscles. The eye's got 6 muscles. Then on top of the sclera, you do have a transparent layer, which is called the conjunctiva. Then the part where, if you touch your eyeball coming from the front, that part that you will be able to touch is called your cornea. Then behind the iris is your lens. Now that is where a cataract develops. And then the vitreous is called the, Cecilia, you'll find there with the screen. Someone is asking a question already. There we go, good. So the vitreous is the jelly on the inside of the eye. Then the inner layer of the eye is called the retina. At the back, we do have the optic nerve, which goes to the brain. And then we have the macula, which is the focus area of the eye. Okay, on the right-hand side is a picture of the eye taken from the front. Now, in other words, through the front part of the eye, we're looking at the very back, the posterior or the very back side of the eye. That part where I cannot show you with my cursor now, unfortunately, But the eye that looks like a sun, where all the blood vessels comes out of the sun, that's the eye nerve. And then a little to the left, you will get that yellowish spot, which is called the macula. And then the blood vessels, you can see the blood flow and the arteries and veins. Good. We can go to the next one. Okay, so then let's have a look at all these pathology cases. On the left top, you will see there we have a glaucoma case. Now, as I explained to you, glaucoma is when the pressure on the inside of the eye is raised. If you think about when you go to the fuel station to pump your tire needs to be pumped a certain amount of pressure for it not to get damaged on the inside. It's the exact same principle. If the pressure on the inside of the eye is too much, it will compress or press onto the eye nerve. Now, that eye nerve is the wiring to the brain, which is extremely important for the messages to get from your eye perfectly to the brain. Now, if that eye nerve is damaged, the damage is irreversible. Unfortunately, there's nothing. The loss is lost. You can only prevent losing more vision. Then on the top right, we do have a cataract there. Now, that is a mature cataract. That eye will basically be blind. On the bottom left, we have a hypertensive retinopathy. Now, if Cecilia, just go back one slide quickly. If you look at that normal pathology on the right-hand side, that normal eye, have a look at those perfectly well-bent arteries and veins. Have a look at that perfectly blood circulation formulation. And so that's a perfect eye. Bear that in mind when we skip to the next one again. Have a look at the bottom left. That is a person with high blood pressure. And have a look at those cotton wool spots. Now, that's basically areas that's dying due to the fact that there's blood leakages. Okay. Next to that one is diabetic retinopathy. So that one is also a sad story. If the blood leakage is in that focus area, that darker area next to the sun, if I can explain it that way, then you will have vision loss. So these patients need to be referred immediately for ophthalmology care. And then on the bottom right, we do have age-related macular degeneration. You do get two types, the dry one, which progresses very slowly, and there's no intervention that can be done there, apart from taking multivitamins, taking multivitamins called Ocuvite. The right one is wet ARMD, which causes leakages, blood vessels to leak, fatty substance from the next layer below the retina to leak, and those patients need surgical intervention. All right, so these cases, you need to refer to the ophthalmologist. Glasses won't necessarily be their first line of treatment. Thank you, Cecilia. So Benjamin Franklin is a very clever guy, or was a clever guy. An ounce of prevention is worth a pound of cure. Very important to take that to heart. We can go to the next one. Regular eye examinations that's very important. Healthy lifestyle habits, proper screen usage. Oh, to me, it feels like after 2020, a lot of people moved from their offices back home. Where did they move to? In front of their computer screens, doing Teams meetings on Wednesday afternoons. And then eye protection and hygiene practices, which we often don't talk about too much lately, as we got a little bit reluctant after washing our hands so much in 2020. Thanks, Cecilia. We can go to the next one. Good. So this is me on the left-hand side doing slit lamp on a patient. So very important is to visit your eye care professional. The World Health Organization recommends going every 2 years, but I like to see my patients even every 1 year. I know a lot of medical aids only pay for an eye test or do have benefits for eye tests available every 2 years. So go with what your medical aid then gives you, but if you don't wait for your medical aid benefits to be available before you go if you have a big problem. Okay. Then healthy lifestyle habits. Guys, this is so important to remember. You are what you eat. I know that you've had a few dietitian talks as well, but this is very important. Maintain a balanced diet rich in vitamins A, C, vitamin E, omega-3 fatty acids. So if we take examples of what especially will work for the eyes, and zinc also. So spinach is a very good, all your dark leafy greens, that's a good source of zinc. Vitamin E, nuts and sweet potatoes. I'm pretty sure we all love sweet potatoes. Vitamin C, it's obvious, all your citrus fruits. Omega-3, your fish, avo, flaxseed. These days, you even do get eye drops with flaxseed oil infused. So that's quite a nice one. Vitamin A, again, sweet potatoes, liver, chicken livers, those of you who like it. Eggs, again, spinach, milk, and again, fish. Stay hydrated, very important for those of you who struggle with dry eyes. Also something to take to heart is to stay hydrated. Avoid smoking. Oh, I know, I'm going to get stepped on here, but it's my responsibility to tell you. Protect your eyes from harmful UV rays by wearing sunglasses. That stethoscope on the right-hand side is there to tell you need to go for your regular GP checkups if you struggle with high blood pressure, diabetes, and all of those. We can go to the next one, Cecilia. Thank you. Smoking, please, guys. There's your sunglasses. And then there's a guy with protective eyewear. Now, I can't tell you how often I do get patients with foreign objects inside their eyes. Most common, a piece of iron they were grinding without protective eyewear. Luckily, I'm not a teacher or someone who needs to be strict about things like this. I've got a lot of grace for patients because I'm here to help. But the first thing I'll ask is, were you wearing your protective eyewear? And the most common answer is no. Proper screen usage, very important. Take regular breaks. Something that's easily remembered. We talk about the 20-20-20 rule. Every 20 minutes, you need to look up at an object 20 meters away from you for 20 seconds. Easy to remember, right? And then wash your hands before you touch your eyes. Very important. Remove your makeup properly. Ladies, very important. You do get a lot of ooey gooey bugs beneath and between your eyelashes when you don't remove your makeup properly. And also important, avoid sharing eye care products like eye drops. But what does an optometrist know, right? So thanks, Cecilia. Next one. Good. What do we check during eye exams? What are you in for when it comes to a visit at our practice? Let me tell you. So our specialities, now I'm proud to say this is my business partner here on the right-hand side. So our specialized equipment entails a topographer, which measures the shape of your eye to determine if you've got astigmatism or not. An optical coherence tomographer, for short, I will refer to it as an OCT. An OCT is an instrument, if you can think about an ultrasound, that's the closest to the explanation I can give. So it takes an ultrasound of the eye, a digital slit lamp, which takes pictures of the front part of the eye, a tonometer, which measures the pressure of your eye, and then we've got a lab, so we do the cutting and fitting of our own glasses at our practice. Right. What happens during a comprehensive eye test at our practice? Let me tell you when we go to the next slide. Again, my motto, by giving vision, I live mine. So first we do a case history, very important. Here by us, you are not just a number. We want to know what is your occupation, what is your hobbies. It's important for me to know someone is a pharmacist compared to someone who's a farmer, because their glasses and the goal for their glasses or contact lenses will be much different. So in terms of the case history, we ask about chronic medication, family history, any hereditary diseases that might be present at the moment. We check your vision. We have a look at how well you see at 6 meters and then at 40 centimeters. We determine your refractive error. Let's refer back to that other slide. If you are myopic, hyperopic, if you have presbyopia and astigmatism, we check intraocular pressure, check the shape of the eye, we check your ocular health, extremely important. A lot of practices neglect to do that. So we will perform an OCT scan or an ultrasound. Then we dispense the glasses and our contact lenses. We also do the training when it comes to the contact lenses. And if someone is struggling with diabetes or hypertension, we will take the glucose and the blood pressure. We also do pediatric eye evaluations. During an eye evaluation, when we test the kid, we will have a look at the eye alignment, whether or not they squint, eye muscle movement, depth perception, that's also 3D vision, color vision, visual fields, pupil reactions, also very important to check that if the pupils are reactive or if they are just standing still. Convergence, that is when the eyes move inward simultaneously when looking at something close up. And then accommodation, which is fine focus at near. A mouthful. So you can think that a visit with me is not only 15 minutes. I'm privileged to be in a private practice where I'm not pressured for time because I want to check every single thing. Now, at the top left, that's me and my son. He's 8 years old now. In the middle, that's my daughter and a friend. I'm dispensing glasses to my son. He's actually really wearing glasses. To the left, it's my business partner's daughter, Clarisse. And then in the center at the bottom, that's an example of a color vision test. I'm pretty sure all of you have seen something like that. And to the bottom right, we do have the stereo test, which will test for depth perception. Good. I want to tell you about a case study. Cecilia, I'm still in time, right? I'm talking your ears off your bodies, but I'm still in time. I don't have a lot more about the eye test. I want to just tell you about interesting things. So I had a 19-year-old female coming to the practice. She was referred by one of the GPs here in Bethlehem, and very interesting. I'm so grateful towards the GP at first, and obviously to everyone involved telling this young lady to come for an eye test, because if that wasn't the case, we would have missed something huge. We can go to the next one, Cecilia. She complained about severe headaches, and she's been having this for months, going back and forth, going to physiotherapists, going to dietitians, going for a lot of things that obviously didn't work. So before giving up, telling her it's stress related, or you know what doctors can say, the GP said, but okay, let's go for an eye test. Go to Maryke, let's see if she can find something great, if she doesn't, great. Okay. What we found when performing an OCT, now remember that's an ultrasound of the eye. Have a look here at the bottom left. Now, if you look at that eye nerve, which is the sunny part that I spoke to you about when we looked at the normal eye, you cannot see. Sorry, Cecilia. Oh, I thought you were talking. That optic nerve, that eye nerve, doesn't have a distinct margin. You cannot trace the optic nerve margin, right? So that is swelling, a lot of swelling, optic nerve swelling. Now, if you have a look at the right photo, you can see that little mountain it's showing. So that should be flat, completely flat. There should be no bulging. If we go to the next one, look what was the diagnosis. She had a brain tumor. So in the consultation room, I had to handle the case subtly because I can't tell her, you've got a brain tumor, you know. Luckily, part of our studies are psychology. So I had to just, you know, prep her for what's going on, but tell her it's quite urgent, because she said, no, she'll go next week. She'll go next week. I said, you know, you're going now. You're going now. So yeah, she had a brain tumor. She was referred to a neurosurgeon for surgery, and luckily the tumor was non-malignant. Otherwise, we wouldn't have had her with us anymore. Okay, so that was an interesting case. Good. The benefits of regular eye checkups. We can go to the next one, Cecilia. It's got a multitude of advantages. First of all, early detection. Eye exams can detect potential issues, allowing for prompt treatment and improved outcomes. Vision correction, accurate prescription lenses or glasses can enhance visual clarity and comfort. Prevention of other health problems. We could see that now with the case study I talked to you about now. Comprehensive eye exams can reveal underlying health issues such as diabetes, hypertension, and high cholesterol. And then monitoring visual development. Quite important when it comes to kids as well. If we detect a problem in a kid's eyes before a certain age, let's say age 6, I need to see them every 6 months just to monitor the development, especially for children. Good. Now, my absolute favorite, contact lenses. I do love glasses, I promise you, but contact lenses to me are very exciting. Good. So we get 3 types. Soft contact lenses. Most of you will know what soft contact lenses are. Then you get rigid gas permeable ones. They are quite old school, small hard ones. They are completely hard, but they're also breathable, luckily. The main disadvantage of the rigid gas permeable ones, they are very uncomfortable. And then we get to my specialty scleral lenses. Now at the bottom left, it's my hand holding the soft contact lens, so you can balance it on your finger. And on the right-hand side, the bigger one is a scleral lens. I will explain to you now why it's bigger, because it needs to be on the sclera, on the white part of the eye. And then you get the small rigid gas permeable one. Good. You can go to the next one. So I didn't put this in this slide, but the benefits of contact lenses overall is the fact that you don't have anything restricting your visual field. If you think about wearing glasses, you only have the parameters of the frame to look through, whereas a contact lens is on the eye, not in the eye, guys, on the eye. It's on the eye, so your visual field is very enhanced, it's wide, it's open. Now, the benefits of scleral contact lenses is quite immense. You have clear vision for patients with keratoconus. Keratoconus is a rugby ball shaped eye. They takes its definition quite well. Distorted corneas, in other words, the front part of the eye not being regular, it's being irregular. If you think about a gravel road, that's the best description there. Irregular astigmatism, and then high refractive error. If someone's prescription is so high that the lenses of their glasses are not cosmetically acceptable anymore. Clear vision for patients who had radial keratotomies. That's a type of surgery that ophthalmologists did long time ago to correct short-sightedness, which didn't end up well 20 or 30 years after. That's why we get those guys now not having good vision. Corneal transplants. It's for patients who've got severe keratoconus. They actually do need a corneal transplant, a new window to the front part of the eye, or unsuccessful or multiple LASIK, which is also a type of refractive surgery. Good solution for hard to fit eyes. So those patients who you really don't know what to do with next, put them on a scleral. Dry eyes, amazing relief for dry eyes. Stable vision, so the way you see this morning, you will see this afternoon. It's long lasting. My scleral patients walk with their lenses for at least 2 years. And then superior optics. Optics refer to the clarity of what you see. Okay. Now, the next slide, I actually drew these pictures myself, quite proud. So on the top left, we have a normal cornea. You will see there the front part of the eye is on the left. So it's a perfectly round shaped cornea. The light rays enter regularly to focus on the macula at the back. At the bottom, we get an irregular cornea, which means that it's like a gravel road, right? So the light rays don't know how to enter the eye. Now, on the right-hand side, there I drew a picture for you with that gravel road cornea. You will see there where I drew the small inserts, insections. That's where the sclera stops and the cornea starts. The scleral lens rests on the white part of the eye. Now, between the lens and the eye, we put preservative-free saline. So that saline, or some people pronounce it saline, goes into those flaws, if I can put it that way, just to correct that irregular cornea. And you basically give the patient a brand new surface on the front part of the eye for light to enter the eye regularly and smoothly. Okay, I hope it makes sense. Cecilia, the next one. So this is a case study of a scleral patient. Amazing what was achieved here. And remember, it's not me, it's the sclerals. He's an 80-year-old male. He's actually a psychiatrist. He came to see me last week. He was referred to me by the ophthalmologist because they basically gave up with him. We can go to the next one, Cecilia. He's got keratoconus. He was diagnosed long ago. He had several corneal transplants in the past. So he had a few chances of getting to see better, which basically failed. The best corrected vision with these glasses, and I'm talking about thick lenses, that's the best someone could do for him in the past. For the right eye, he sees 5%. Remember, that's the best. With the left eye, he sees 30%. Now, this guy can be classified as legally and functionally blind, which means he's not legal on the road. He's danger to all of us. The ophthalmologist was at the verge of giving up with him, but luckily he remembered about us doing scleral lenses. Look at this. I hope you're all looking at the screen at the moment. We could get his right eye to 95% and the left eye to 95% also. What is the end result? A happy patient. Shame, I felt for him. As soon as I showed him what he will be able to see, he walked to my reception and he was actually very distorted in terms of he was disorientated. He was very dizzy because it's a lot of info for the brain to process at age of 80. Luckily, he's a psychiatrist, so he knows the ways of the brain. So the brain will adapt quite quickly. We can go to the next one. There you will see the grayish streak at the bottom is the cornea. The next layer is the preservative-free saline, and then on top you will see the lens. I hope it's difficult for me to explain without my cursor, but Cecilia, if you can just go into that yellowish block with your cursor, exactly there, perfect. Now Cecilia is on the lens. So that whole part from the left to the right, that whole bow is the lens. Beneath that is the fluid layer, and then the grayish area is the cornea. Okay, good. Next one, I'm already seeing a question I would love to answer, but we'll get to that now. Safe to say, contact lenses and optometrists, especially me, we make a great team. Good. I'm almost done, guys. Almost done. I'm enjoying myself tremendously. Good. So that's it for the sclerals. Just before we end this meeting, I just wanted to touch base on the Eye Care Awareness Month, which is 24 September to 18 October. Now, these info were sent to us by the South African Optometry Association, and I used this to just check off my checklist that I covered everything when it comes to eye protection. So the importance of sun protection. Before I talk about this, I need to talk to the parents. Guys, please don't let your children look directly into the sun. As a belief, it causes irreversible damage. Those UV rays enter the eye directly and they burn a black hole at the back. I remember when I was in primary school, we had, what is zonsverduistering in English? We had an eclipse. And we all looked through Joko tea bags to have a look at that sun disappearing behind whatever it was. And I now see a lot of damage caused by that time because people were uninformed. So not even looking at a source of water reflecting light rays. As a belief, they should really not look into the sun directly, but that's just a footnote. Always invest in a good quality pair of sunglasses. People will ask me, where do I get these sunglasses? I answer them, not on the street. That's the best answer I can give them. Sunglasses protect the eyes from damaging UVA or B radiation. You will see on the sunglasses, on the lenses, it should specify UV 400. Then you know it's correct. It's a good pair to buy. UV damages the eyelids, cornea, lens, and retina. We all know UV damage causes cancer also. When working outdoors, good. And then in windy conditions, sunglasses can protect against debris. We see that a lot in the Free State with the farmers wearing protective sunglasses for the dust. Good, we can go to the next one, Cecilia. Thank you. Okay, safe driving. We all want everyone to be legal on the road. All drivers must visit an optometrist for a certificate of competence. We give out a lot of those certificates. Good vision is important to ensure the safety of pedestrians and other drivers. Anti-glare, that's something, if you want me to explain it to you more in depth, you're welcome to take my contact details and I'll explain anti-glare to you. It's basically a coating that we put on a plastic lens to prevent the lenses from glare, from glaring, so you won't have any shiny reflections in your eye, in your glasses. Cataracts, glaucoma, and retinal disease cause poor vision for drivers, so we need to diagnose that. And then obviously diagnosis and management or referral can be done by us. Good, next one. Digital eye strain. There it is, the 20-20-20 rule. Wear your glasses in front of the computers. That's important. Adjust your computer screen to 20 degrees below eye level. Also very important. Blink more or use artificial tears. It's been proven that your blinking rate decreases when you do a lot of computer work. Adjust brightness, font size, and contrast. When my kids are on their telephones, I switch on all the lights inside the house. It's very bad for the eyes to sit in a dark room with a bright light source in front of your eye, because it's obviously very concentrated. And then anti-glare screens or screen protectors. Also something that's not here, you do get a coating, an anti-glare coating specific for the blue light rays that gets emitted from laptops and digital screens. So a certain amount of blue light can reduce your melatonin levels. Now, melatonin is produced by your body naturally to let you sleep. Now, if you are on computers a lot, it means your melatonin levels drop and you're a poor sleeper then. Good. Protection in the workplace. Safety glasses. Wear your goggles when you are grinding. Construction, welding, and mining. They can protect against high intensity harmful light. Safety glasses. Ensure adequate training on safety protocols. Know where to go if there's an accident at work. Don't wait for weeks before you come see me after you've had an incident with grinding and had a grinding spark in your eye. They produce rust, and it's quite tough to remove that rust ring. So the sooner, the better. When in doubt, send it out. Come. Next one, Cecilia. Good. Guys, it was a mouthful. The best way to thank your eyes for their hard work is to take care of them. A very clever, unknown person. And that's it from me. Thank you.
Oh, wonderful. Yes, I totally agree. It was a mouthful. Thank you very much, Maryke. I must also say one thing that I've learned this afternoon is that the terminology of optometry is heavy. It's really heavy. There's big words. There's some big words that yeah. But thank you for explaining that to us. Okay, now we need to give some attention to all the questions, and there are quite a lot.
I saw.
All right, let's start. Let's just go back from the beginning and see. All right. I've got it. I'm not going to try to pronounce the names.
Good.
But I'm going to read the answers and then you can answer, and then I will look, the person can just give me a thumbs up if they're happy, or they can unmute themselves and just elaborate on their question. All right, this person, Imelda, asked, at what age can we take our kids for eye testing?
So if there's a problem before age of 6 years, you can take them before age of 6, but I would recommend definitely before school. So grade R, age of 6. Even if you don't see anything wrong at home, or even if you as a parent don't think there's anything wrong, just take them, make sure, so that they are school ready. So age of 6, I would recommend.
Wonderful. Thank you very much, Maryke. Um, then another question. I have been to the ophthalmologist
Apologies, yeah.
in 2019, sorry for that, for a cross-linking procedure as I have keratoconus in my left eye. I've
Yes.
been to the optometrist about 4 months ago for an eye test, and the left lens on my glasses is very thick and strong. Do you suggest I go back to that person? And how often should I see that person again? And is there a way to regain or improve the blurry vision in the left eye? That's thank you from Arusha.
Yes, Arusha, thank you for that question. I do get that a lot. First things first, hats off to you for getting the cross-linking. It's very painful and sore. So I'm proud of you doing that. So cross-linking stops the progress of keratoconus. I'm not sure what is her age, but if your optometrist is not a scleral contact lens practitioner, I suggest you find one for you because your way to go is scleral contact lenses. Um, Unfortunately, when you only correct an eye like that with glasses, if your prescription is high, the lenses will be thick. So cosmetically, it won't be very nice to wear thick lenses like that. And you won't get perfect vision with glasses because, as I said, if your cornea is distorted, which is the case after cross-linking, the optics of that eye will never be 100%. But if you do scleral contact lenses, your chances are very, very good of getting even perfect vision. So you, Cecilia, I can give all my details to all the listeners, and they welcome to email me,
We will.
so that I can tell them who are scleral optometrists in their area, because
Yes.
we are a few. We are a few.
Yes.
We're not a lot. She can
Yes.
even come to Bethlehem if she'd like, but I
Yes.
would say go for sclerals.
Yes, thank you very much, Maryke. We only have 3 minutes left for questions anyway. So if there are any other questions besides the ones that is written here, which we will send to Maryke to answer you directly, then please put it in the chat box. We will forward all the questions to Maryke to answer directly to you. And the recording will be available afterwards to everyone, as well as the presentation. Just another question or two. Is there laser treatment available for presbyopia?
Myopia. Yes, there is. Success rate, I cannot really comment on because I haven't referred any patients for that. One must remember LASIK procedures are cosmetic. So it doesn't mean that your eyes have got a problem. If something can be corrected by glasses or contact lenses, then the medical aids, won't cover for LASIK surgery because it's cosmetic. But one piece of advice, choose the correct surgeon. Make sure that surgeon specializes in LASIK, and they have been specializing for years. So I hope
Okay.
that's the correct answer. But yeah, the answer is yes. There is LASIK surgery for that. Yes.
Okay, wonderful. Yes.
There
Okay,
was a
then
question about RK. Cecilia, I want to answer that. A patient
yes.
who had radial keratotomy a few years ago. I only saw it during the presentation. Scleral lenses, that's your answer. I've got a lot of RK patients whose vision improved from 50% to 100%. They are happy chappies. I've got testimonials and all of that. So RK, next step is sclerals, definitely. Come visit me in Bethlehem.
Okay. Then I see here's a question from unknown user. My sclera is not white. Should I be worried?
Yes, um, there's a lot of reasons for that. I need to say this. You must check your liver. You must basically go for a good uh, checkup at your GP. Do blood tests for liver functioning, for kidney functioning. Jaundice is one of the main diseases that can show in your sclera, or it can just be an eye allergy. It can be from something as simple as an allergy to something very serious like a liver problem.
Okay. All right. I think we're going to end the questions for now. I see there's still a lot of questions, so you're going to be
Sure.
busy for the following day or two, Maryke.
All of them, though. Thanks,
But
Cecilia.
yes, once again, I just want to say thank you so much for your time and the absolute valuable information that you gave us. I'm sure our attendees are happy. And as I said, the presentation and audio, recording will be made available to everyone afterwards. And yes, so thank you very much and have a wonderful afternoon and soon to be weekend.
Thanks, Cecilia. Thank you, everyone. Have a good afternoon and evening. Thanks so much.
Thank you, Maryke.
Thanks,
Bye-bye.
kiddos.
Bye.
Bye
Thank you
now.
so
Thank
much.
you. Bye.
Cheers.
Bye.
Bye,
Bye.
guys.
Thank you. Bye.
Thanks, bye.
Much
Bye.
appreciated.
Bye.
Thank
Thank
you,
you,
bye-bye.
Celia.
Bye.